Good afternoon. Thank you all for joining us today. On behalf of the Commissioner of Higher Education and our entire benefits team, I want to welcome you to annual enrollment for fiscal year 23. I appreciate all of you taking the time to walk through what you can expect as you go through the annual enrollment process and any changes to benefits that you might see as you walk through your annual enrollments. So again, this is for fiscal year 23, which will run from July 1 of 2022 through June 30 of 2023. Our agenda for today will be much like we have done in the years past. We will talk first about just a little bit of self-funded plan information, then our annual enrollment dates, our medical plan benefits, prescription drug benefits, our dental plan, the optional vision hardware plan, the premium rates for fiscal year 2023, premium payment information, pretty exciting news about the 2022 wellness program. And I will just let you know that the wellness program runs on a calendar year, whereas all of our other benefits run on a fiscal year. The 2022 wellness incentive program, and then a few enrollment reminders. We've talked about this in the past, but I think it's important that we talk a little bit about what it means for our plan to be self-funded. And there are a couple of basics. One is, of course, that all of our self-funded plans, which is medical, prescription drug, dental, and vision hardware, are self-funded, meaning we are all pooling our premium contributions into a fund, which we then use to pay out the cost of benefits for those plan participants who need to utilize services, whether it's through an injury, an illness, your preventive care, whatever the case may be. The other thing that's really important is to understand that our health plan, like most of our benefits, are at their core tax vehicles, and as such, they are regulated by several federal agencies, including the IRS, the Internal Revenue Service, the DOL, or the Department of Labor, and then HHS, which is Health and Human Services. And then on a number of the benefits, we also have regulation from CMS, which is the Center for Medicare and Medicaid Services. So as part of our goal to keep the plan financially sound and affordable for all of our participants, it really is important for all of us to use our benefits responsibly. And as part of the plan design, we are expected to pay a portion of the medical costs in the form of annual deductibles, percentage coinsurance, and in some cases, flat dollar copayments. The cost containment features that are built in as part of the plan designs are there so that funds are available for all of us should a high-cost medical emergency or a catastrophic illness come to a plan participant. Our annual enrollment dates for fiscal year 23 will start on Monday, April 25th, and they will run through Friday, May 13th. If you do not want to make any changes at all to your benefits, you do not have to do anything. If you do want to make changes, you will want to make sure that you get your enrollment form with your changes to your Human Resources office no later than the end of business on May 13th. So our retiree medical plan benefits for this year are not changing. The plan design is not changing. So you will not see any changes to your deductible, your co-pays, your co-insurance, or your out-of-pocket maximum, with one caveat. The specialty office visit copay for psychiatric services will no longer apply beginning July 1 of 2022. Instead, psychiatric services will have the $30 copay applied, and that is a requirement for us to remain in compliance with the mental health parity law. In addition, we're really excited to let you know that we are adding a hearing aid benefit, and I'm certain I can hear some of you cheering even from out in the technology world there, but we have had requests for a hearing aid benefit pretty routinely over the last probably 5 or 6 years. And this year we were finally able to get this benefit in. Many of you probably don't have a need for the pediatric hearing aid benefit, but we put it here anyway, just so that you know that that benefit is available for plan members 18 years or younger. And that includes one hearing aid per ear every 3 years, subject to deductible and coinsurance. We also, though, are adding a benefit for adults, a hearing aid benefit that will be available for plan members ages 19 or older. And the benefit will include a $2,000 per ear lifetime maximum. It is subject to deductible and coinsurance, but the hearing aids will process on the in-network benefit. There is not an adequate network established, so these devices will process under your in-network benefit. The pediatric hearing aid benefit is actually statutorily required. The adult hearing aid benefit was a decision of our benefits team, the inter-unit benefits committee, and the commissioner. So we're very pleased to be able to offer you that benefit in addition to the other benefits that are already available under the medical plan. And then just a few reminders about choosing quality care for you and your family members. Blue Cross Blue Shield has special contracts with a number of places that offer specialty care. So if you are in need of some of these certain specialties, such as bariatric surgery, cardiac care, knee and hip replacement, maternity care, spine surgery, or transplants, there are special locations that are called Blue Distinction Centers. So as you begin to navigate for yourself or your family members through these types of needs, I would encourage you to reach out either to Blue Cross Blue Shield or to our office here at the Commissioner's office, and we can help you navigate through some of those types of services, and where appropriate, get you to a Blue Distinction Center. Our prescription drug plan for fiscal year 23 will continue to be served by Navitus as our pharmacy benefit manager, and Lumacera will remain as our specialty pharmacy. Now, on the prescription drug side, you probably recall that there is a difference between those who are under age 65 and not Medicare primary versus those who are 65 or older and are primary on Medicare. So this next just piece of advice as a reminder is that for those who are not Medicare primary, CVS, Target, and the Bozeman Western Drug Pharmacies are not participating in the pharmacy network. So if you are not Medicare primary and you utilize one of those pharmacies, you will be responsible for all charges. This is not true for those of you who are Medicare primary, as Medicare does process first, and then your EGWIP or your employer group waiver plan wraps around and picks up after Medicare, and therefore, because Medicare requires an open pharmacy network, you are free to use any of the pharmacies that are available to you. Remember that your prescriptions can be filled at a participating retail pharmacy for either a 34-day supply or a 90-day supply. We added the 90-day supply at retail pharmacy benefit several years ago, and we have received a great deal of positive feedback about that benefit. So we are pleased to be able to continue offering that opportunity to have your 90-day fills for your maintenance medications from a retail pharmacy. It's important to know, though, that you also do have several options for mail order prescriptions for 90-day supplies as well. Those can be filled through Ridgeway mail order, Costco, or MyRx. Just keep in mind that MyRx has a limited delivery area. They will deliver only to Montana, Idaho, Washington, Wyoming, and North and South Dakota. There are no changes to the prescription drug plan design, so your copays will remain the same. The out-of-pocket will remain the same, so you will continue to have the tier $0, the tier 1 that has a $15 copay for a 1-month supply, or a $30 copay for a 90-day supply. Your tier 2 medications will have a $50 copay for a 1-month supply and a $100 copay for a 90-day supply. Tier 3 drugs have a 50% coinsurance. That coinsurance does not apply to your out-of-pocket maximum. Tier 4 is your specialty medications, and those have a $200 copay unless they are purchased at a retail pharmacy, and then there is a 50% coinsurance. That coinsurance does not apply to your out-of-pocket maximum. The out-of-pocket maximum for fiscal year 23 will remain at $2,150 per individual and $4,300 per family. So a few reminders for Medicare retirees. You will continue to be enrolled in the Navitus Medicare RX Part D prescription drug plan. And then you also will have our university system drug plan. So it is really important that you keep in mind that you must be enrolled in Medicare Parts A and B, and you cannot be enrolled in another Medicare Part D plan. So part of your prescription coverage through the university system with Navitus includes that Medicare Part D. Do not enroll in another one. If you do enroll in another Medicare Part D plan, or if you are not enrolled in Medicare Parts A and B, you will be disenrolled from the university system plan. Keep in mind that if you have Medicare primary, you will be, as a member, enrolled as an individual and not as a family. And this began with the advent of the EGWIP program, which is the Employer Group Waiver Plan. And that's that combination of our Navitus Medicare RX Part D and the University System Employer Group Waiver Plan. So if you are a split family, just remember that all of your eligible prescription drugs are going to go only to an individual out-of-pocket maximum. And then keep in mind that some of you may have one party who is pre-65 and one party who is Medicare primary. And in that case, you may have a split family. And that's important for you to know, because that means that one of you will be enrolled on our regular commercial plan, which is the regular employee university system drug plan, and the other will be enrolled in the Medicare prescription drug plan. So in that case, what's really a little bit unusual about that is that your accumulators, for those who are on Medicare primary, run on a calendar year from January 1 through December 31, and the rest of the Medicare or the non-Medicare retirees will run on the fiscal year. So we understand that that's a little bit confusing. If you have questions about that, particularly if one party ages into Medicare and the other one is still not Medicare eligible, we do have people who have a number of questions around that and how it works. Don't ever hesitate to reach out to you, and we have staff here who can help walk you through that. And then, as in years past, there will be an opt-out period that is required. That's part of the CMS regulation. And that period will run through from October 12th through October 29th of 2022. But just keep in mind that if you opt out of Navitus, you are opting out of the university system medical coverage. The pharmacy and medical are together, so you will be disenrolled from the university system medical plan if you opt out of the pharmacy plan. I recognize that that can be confusing sometimes as well, particularly when you get the Navitus opt-out notice, but just understand they go together. So if you opt out of the pharmacy benefit, you are opting out of the medical plan as well. One change that we actually have implemented effective April 1, 2022 is the Copay Max Plus program. We were able to offer this a little bit earlier than normal. Typically, we would make any changes effective July 1, but the reason we could do this is because it doesn't require a notice of material modification, because there is no detrimental impact to you as a plan member. And since this program actually provides a win-win scenario, it is to the benefit of you as a plan participant and to the plan. We decided to go ahead and offer it at the earliest opportunity which was April 1 of 2022. So you may recall that last year, July 1 of 2021, we implemented the Copay Max program. The Copay Max Plus program just takes that one step further and offers about a little over 200 additional drugs where there is a manufacturer copay assistance program available that can reduce your out-of-pocket cost as a plan participant and also provide some savings, financial savings to the plan based on the amount that the manufacturer, the pharmacy manufacturer, will provide in assistance. Now, please keep in mind that this program is only eligible to those who are not Medicare primary. The reason is because if you are Medicare primary, Medicare does not allow utilization of any coupon programs, copay assistance programs. They don't allow them as part of Medicare, and therefore we cannot offer them to you either. But if you are not Medicare primary, the way that the Copay Max Plus program will work is that the amount that you pay for your medications will be set to the maximum of either our current university system formulary benefit tier level, $0, or the amount determined by the manufacturer funded copay assistance program. Now, in my experience, what I have seen most often is that with the manufacturer assistance program, a copay will be $0, $5, $10, or $15. Those are the ones that I see most commonly. So just to illustrate how this would benefit you as a plan participant, if your drug currently has a $50 copay and you now have a $5 copay by utilizing this Copay Max Plus program, then that clearly is a benefit to you that you'll pay less out of pocket. And in addition, the plan will pay less because there's a certain amount of money that is actually paid by the manufacturer. If you are someone who qualifies for the Copay Max Plus program based on a prescription that you have already filled, you should have received a letter from Navitus explaining the program and telling you how this will work for you. We have been asked if we could provide a list of the drugs that are included in this program, and unfortunately we cannot because it is a moving target. The drugs change, the eligibility changes based on those that the manufacturers are currently providing copay assistance for. But if you are on a drug that is eligible for the Copay Max Plus program, you will be notified by Navitus. And then one final note on this program, the amount that you pay out of pocket is the amount that will be applied toward your out-of-pocket maximum in the Navitus system. So for instance, if the normal copay is $50, but you paid $5, the $5 is what will apply to your out-of-pocket maximum because that is what you actually paid. And then we just wanted to provide a quick reminder of the Sempre Health Discount Program. This actually went into effect last plan year, so our current year, July 1 of 2021. This is an SMS-based or short message service. We refer to it more frequently as text messaging program. And its intent is to improve adherence and affordability for chronic disease medications by lowering your copays when you fill your prescriptions consistently and on time. So in essence, it is really designed to encourage medication compliance. There are a number of positive impacts to medication compliance, both for you as a patient and for the plan as well, because you will see things like a lower number of emergency room visits or hospitalizations, or just that your illness is controlled better so you have a better quality of life. There are just a number of positives that come from this. Right now, there are only 6 drugs included in this program, and they are noted there on the lower right-hand side of the screen. Again, this program is only available to our commercial plan enrollees, which is the regular Montana University System plan, so our non-Medicare retirees. And again, it has to do with the Center for Medicare and Medicaid Services and their regulations around what is allowed for Medicare prescription drug programs. Let's spend just a couple minutes talking about your retiree dental plan benefits. We continue to partner with Delta Dental for the administration of your select dental benefit plan for fiscal year 23. There are no benefit design changes for the upcoming fiscal year, and there are no premium changes for the upcoming fiscal year. The only change is that we are increasing the fee schedule reimbursement maximums for many of the dental codes, so you may notice that. And that is a step that we've been working at, increasing a little bit at a time over the last couple of years. So this is just one more step in that direction. On your select plan, it is a comprehensive dental plan. So you will have diagnostic and preventative, basic, major restorative, and then also a lifetime maximum of $1,500 for orthodontist services. For all the other services, there's a $2,000 annual maximum per covered member, with the exception of your diagnostic and preventive services. Those do not apply to that $2,000 maximum. We were able to implement that benefit a few years ago, and it has been very well received, and we think it's in your best interest to have that waiver on the diagnostic and preventive services, because that way, if you have a year where you have a number of dental needs, let's say you need a root canal and 2 crowns and you max out that $2,000, that does not mean that you should not go get your teeth cleaned or your regular exam, because you can still have those services if you have met that $2,000 maximum. The optional retiree vision hardware plan will continue to be administered by Blue Cross Blue Shield of Montana. There are no hardware plan changes for fiscal year 23. Just keep in mind that the optional vision hardware benefit is only for your hardware. Your eye exams, whether routine or medical, are covered under your medical plan, and the first one per plan year has a $0 copay when that service is provided by an in-network provider. So for the hardware benefit, you have a benefit for your eyeglass frames and lenses in lieu of contacts. It's one per plan year, up to a $300 annual allowance per covered member. Or you may choose contacts in lieu of frames and lenses, one purchase per plan year, up to a $200 annual allowance per covered member. So now on to the big news. I know this is what you're always waiting for. This is what we usually have a few calls about before we even have the information ready for you in a public format. I'm really pleased and proud to let you know that we will have no premium increases for fiscal year 23. So if you do not make any changes, then the premiums that you pay today are the premiums that you will pay July 1st. If you do have any changes, of course, your premiums are dependent upon which coverages you have and whether or not you are covering any dependents. For your select dental and your vision hardware, again, there are no premium changes for fiscal year 23. So the premiums that are there today are the premiums that will be in force on July 1 of 2022. Regarding your premium payments, if you are a direct bill retiree, you will continue to submit your monthly payments to Benefitsolver. You do have the opportunity for online payments, and you can access that through the MUS Choices homepage, and that would be an ACH transaction from your bank. You also have the opportunity to pay directly by sending in a coupon along with your payment, and that goes to Benefitsolver at the address that is on that coupon. If you pay your monthly premiums via the teacher's retirement system or the public employees retirement system, you will continue to have your monthly premiums automatically deducted from your plan, your pension plan. If you are making changes, please make sure that you have them to your HR department by that deadline on May 13th. This is especially critical in the event that there is a need to make some kind of a premium payment change, because that needs to be into those systems well in advance. So just make sure that if you are making changes that you get them in by the May 13th deadline. And then we just put up a picture of our website that shows you where you can go on the Choices website if you need to log in to the system to make a payment. So you can actually access that through a button that takes you to a link into that system right from our home screen. And then this is just a little bit of a step-by-step walkthrough that shows you where you would go to register for the Benefitsolver platform, or if you have already registered in the past, you would enter your username and your password. Now on to some exciting news for our retirees. We have been asked for many years to have some additional opportunities for wellness. So let's talk a bit about what the highlights are for 2022 for our wellness program. Now keep in mind again that wellness runs on a calendar year where our other benefits are running on a fiscal year. We will continue to have live fitness and nutrition workshops and webinars. Those are provided by our wellness program here. We will have the Montana Moves and Montana Meals blogs again through our Montana University System Wellness program. We will continue to offer the Take Control Lifestyle and Disease Management program. We'll offer Wonder Health, Hinge Health, Well on Target, and the Blue 365 discount program. Those are all offered through our contract, our third-party administration contract with Blue Cross Blue Shield of Montana. Then remember that Delta Dental offers Amplifon and QualSight. Those are discount programs for LASIK eye surgery or hearing aids. And then the really exciting piece is that for the first time, we are able to offer the Wellness Incentive Program to our retirees. Our Wellness Incentive Program has moved to a new platform. So we had the Limeade platform for 7 years, and we are required by statute to go out for bid every seven years. So we cannot extend a contract beyond 7 years without a new request for a proposal. So we did go through the procurement process, and Virgin Pulse was the successful bidder for that incentive platform. Just a little bit about Virgin, the holding company, and where that name came from. The name Virgin arose in 1970 when Richard Branson and Nick Powell formed a record shop. It was first formed as a mail order record shop, and then in 1971, they actually opened a physical store. Branson and Powell considered themselves virgins in business, and that is where they came up with the name for Virgin as their company name. And then it has expanded. There are so many Virgin companies now. Virgin Pulse is actually the wellness hub, but many of you are probably familiar with a number of the others, the Virgin Hotels, the Virgin Airlines. But we just wanted to give you a little bit of the background of where that name came from. And then Richard Branson described the V in the logo as an expressive tick that represents the Virgin seal of approval. So a reminder about the Take Control program. And again, this is a program that is for our non-Medicare retirees. It is a disease management program, a lifestyle management program. It's voluntary and confidential. And it is a telephonic delivery program that allows participants to be involved from anywhere and receive individual attention that is specific to your needs. It is a 12-month program that includes one-on-one monthly health coaching. And those sessions are with licensed dietitians, exercise and sports science trainers, and certified diabetes educators. There are a number of health conditions, and there are criteria to enroll in the program, but the conditions include high blood pressure, high cholesterol, weight loss, diabetes and prediabetes, tobacco cessation, and then there is also a maternity program. Wonder Health, formerly called Naturally Slim, is a metabolic syndrome reversal program. And this, remember, we launched on July 1 of 2021. We're able to access this through our contract with Blue Cross Blue Shield of Montana. And this is a behavioral counseling program to reverse metabolic syndrome. And also it helps with weight management and diabetes prevention. It is a 10-week counseling program that is really set up and designed for skill building, followed by 10 weeks of customized skill reinforcement, and then 32 weeks of maintenance. You have the opportunity for interactions with health coaches and online social support. This is available at no cost to you, and it's for participants over the age of 18. We will also continue offering Hinge Health. Again, this is available to us through our contract with Blue Cross Blue Shield of Montana, and this is a musculoskeletal management program. This is a 12-week program that really has helped a number of people assist with pain management, injury recovery, and regaining their active lifestyle. We've received a great deal of really positive response, and we have heard from a number of retirees that you do appreciate the opportunity to participate in this and some of the other programs that we were able to offer. This one starts with a tablet and some wearable sensors, then includes health coaching and personalized exercise therapy. Again, this one is available at no cost to you as the plan participant and is for people over the age of 18. Then I wanted to remind you about the Well on Target portal that is provided by Blue Cross Blue Shield of Montana. You access this through the Blue Access for members. If you have an account, you just need to log in. If you're a new user, you do need to register for an account. But once you're in there, you can click on the wellness link and then visit Well on Target, and you'll be able to get into that portal. The Well on Target portal has a number of different offerings. There are some things that you can do that allow you to earn blue points. And there are a number of questionnaires. There is some information that will help you with your own wellness and well-being, and then some activities. The blue points that you receive, you can then cash in for merchandise. So if you do log with a fitness tracker, if you have a wearable device and you connect it to this Well on Target portal, it will track your steps every day and you will receive points every day as you take steps for having that attached to the portal. This is available to all of our plan members age 16 and older, and this is in reference to the fitness program, and this is an opportunity to join fitness centers at a reduced cost. This also is part of the overall Well on Target portal and allows you to earn additional points. Then another program that Blue Cross Blue Shield offers to us, to all of our plan members, is the Blue 365 Member Discount Program. And this is a program, and we've included the website address here for you, but this is really just what it says. It's a discount program. You can receive discounts on footwear, fitness items, hearing and vision, home and family items, nutrition, personal care items. So I would encourage you to check that out and just see what kinds of discounts you may be able to utilize. Then a quick reminder that Delta Dental also offers us, through our contract with them for third-party administration, some savings on both LASIK eye surgery and Amplifon hearing aids. So this program allows for discounts of anywhere from 5% to 62%, depending on what the services are and which provider you select. So we've included the websites if you're interested in either the LASIK eye surgery or the discounts on the hearing aids. So the Wellness Incentive Program, I already introduced you to the Virgin Companies and Virgin Pulse, but we're really excited that we are able to offer the Wellness Incentive Program to our retirees. This program actually launched on April 4th, so we encourage you to get signed up. You just go to join.virginpulse.com/MUS to enroll. And there will be a number of opportunities for you to participate in challenges, in completing some questionnaires, in a number of different health incentives. So it's really designed around getting you active and involved in your own health and well-being. You will also have the opportunity to earn Pulse Cash, which is really points toward items in the Virgin Pulse store. One thing that's been a little bit exciting about this platform is that you can also invite people who are not on our health plan to log into the platform and participate in challenges. So if you wanted someone, maybe you have a good friend that you walk with and you want to be able to challenge them to a weekend rumble or something where you're going to see who can get the most steps over a weekend. Even though they don't have the University System Health Plan, they can get on, you can invite them onto this incentive platform. They just cannot win or earn the incentives, but they can participate in the program and the challenges. And then just a little bit of background about Virgin Pulse. We've already talked about where the name came from. This is a global company. Virgin Pulse is a well-being company that is in a number of countries, about 119 countries. So they've actually purchased a number of smaller wellness companies and platforms, but they really have perfected some of the platform types of programs in the wellness arena. And then just a little visual for you of the Virgin brand and the numbers of companies that are associated. I think I called out the Virgin Hotels and the Virgin Airlines, but you can see there are so many. We have Virgin Pulse right in the center because that is the company that we're utilizing for our Wellness Incentive Program. So a few retiree enrollment reminders. Just remember again that our annual enrollment dates are April 25 through May 13. Your enrollment forms with any changes must be received by your HR office by May 13th of 2022. If you do not submit any changes, you are automatically re-enrolled in what you have today. Your workbooks, your letter, your benefit books, all of those items were mailed out to you. We apologize, first of all, because we did have some issues with regard to some unintended consequences, I think, of still being kind of on that tail end of the pandemic. And there is, believe it or not, a paper shortage. And then there are a number of issues with mail and how long it takes to get certain things. So the benefit books, along with all of your letters and information, have been sent out. Huge apologies if we recognize that there are going to be people that did not get them in time for this presentation, but we will be posting it on the website next week. It should be available by next Wednesday. And if you happen to be on today on the live presentation and you hear from people who didn't get their packet in time, please extend our apologies and encourage them to reach out to our office if they have questions or if they need any kind of assistance. We are happy to help. Just a final reminder about your network providers. It is critically important on the medical side that you are checking the status of your providers to ensure that they are in network. Never assume that your provider is in the network. Always double check. You can do that through Blue Cross Blue Shield of Montana, either on their website or with a phone call. You can contact our office if you need help finding an in-network provider. And then we also just tell you that Delta Dental does have provider networks. They have a PPO dental provider network and a Premier network. And if you are able to utilize Delta Dental network providers, it may benefit you from a fiscal standpoint because they do have contracted allowances with Delta Dental. The university system dental plan, though, is actually designed as an indemnified fee schedule. So we actually set reimbursement rates for every dental procedure code, and that is the maximum that the plan will pay regardless of the network status. Sometimes people get a little bit confused about that, so I just wanted to be clear that the maximum is always our fee schedule reimbursement amount. And with that, we will open it up to any questions that you may have. We are going to stay on for probably the next 5 to 10 minutes or as long as you have questions, and then we'll end the meeting. I sincerely appreciate you taking the time to join us today, and we are thankful to have you as our retiree plan members. We hope that you understand that you are valued and appreciated, and we're just pleased to be able to extend the benefits that we are able to this year with no increase in premiums. So with that, thank you very much. Have a great afternoon.